going live. Let's do it live. All right. So I see a couple people already on board. We got Bill C. It says, just sing it. O. Okay. And Jae Oh says, Denise, daylight coming. I want to talk Medicare. Denise, you might need to revisit your lyrical skills there. So just remember, Jay, we just got done talking about Michigan football and Georgia football, and so we don't need to, let Jay, because Jay, are you in Ann Arbor right now, or where are you right now?
Yeah, that's right. I'm in Ann Arbor.
Yeah, so
we're still basking in glory. Don't worry.
Jay, right, exactly. The only reason you guys won, because you played, was because I went to Michigan, Jay, in October. I took one of my boys to go see, Grand Rapids, whatever it's called, and we went to Traverse City and all that. And by the way, so check this out. Hey, Denise. Not only did Michigan win the championship after old Josh stepped in, but the Lions went to the NFC championship, and they frankly should have won too. So both teams sucked until I came to Michigan, and then they both had massive years. And so it's funny because we got my son a Lions sweatshirt. We went September or October. I think it was October. I'm just putting it out there, man. Just putting it out
there. There are plenty of new citizens on the bandwagon, for sure. I think it's an incredible turnaround, really.
We'll see. Yeah, we'll see. All good. All right, so Jay, of course, is Maximize Your Medicare, and he has a updated book. You have the 2025 edition, Jay. You got a
2024, 2025. That's right.
You got a copy there you can show people.
Actually, we're all out. It's like crazy. It's crazy.
The worst salesman in history, man. Come on, Jay.
I'm terrible at marketing. I'm a very reluctant marketer, but this is an important year. More people will turn 65 this year than any other. And it's not 10,000 people a day. It's 11,000 people a day.
Crazy.
Peak 65.
So MaximizeYourMedicare.com, right? That's the website.
That is correct.
And then your other website for people, I just want to put down the front and the back of the interview here. So you got MaximizeYourMedicare.com. You have your Substack, which is interesting, which I subscribe to. I can't remember if I paid for it. I don't recall, but I subscribe to that. And anyway, so before we get started, Jay, how do people find you first and foremost?
Sure. That the Substack is just my name, JAEOH.substack.com. I put it in your chat, but I can't connect for whatever reason. What I'll do is I'll send it to you, Josh, and you can copy and paste it. There's a free and a paid version. And so, based on the other things that I do, there are things that I'm happy to say in public just for general purposes. There are certain things, as you probably do, I want to say you've got also a different service, but a paywall that, there are certain things that are too private that, because my first objective is to have people correctly informed. And then, do I have opinions on top of that, professional opinions or personal opinions, of course, and about the contracts and, whatever else is going out in the atmosphere about financial this or that. So
trying to link your Substack here. What the hell, man? So it's substack.com/JO. Is that what it is?
No, it's jo.substack.com. I put it in your private chat on StreamYard. So and the thing is, unfortunately, I cannot comment because I tried to connect on YouTube, but operator error over on this end. So hello to Marie. I can see the comments.
All right. So you can see the comments though?
I can see the comments. I can't make comments. I think that the world probably appreciates that.
Marie, 11,000 a day was how many people turn 65 now, Marie. That's Marie just asked.
That's correct.
11,000 a day. 11,000 a day are turning 65.
This is peak 65. This is the year that more people will turn 65 and that explains all of the pressures and crossfire. I mean, just relentless is the adjective I would use. Just relentless.
All right, so I'm putting the link to your MaximizeYourMedicare.com page as well, website. All right, so just real quick, guys, because Jay and I haven't. I mean, we texted every now and again, but It's been a long time, probably maybe 4 years. So Jay and I were doing initially, I think we did a pretty good job actually, like a breakdown of Medicare for various states. It was a lot of fun. Man, that must have been 5 years ago, Jay. Crazy. And Jay, he's just one of the, I talk about Jay all the time in terms of the Medicare stuff. We just texted each other, hey man, let's revisit this because it's important, especially given what you just said, Jay, but 11,000 people a day. And sadly, of those 11,000 people a day, 10,995 have no clue what the hell they're getting into. You know what I'm saying? So this is where the information is so critically important. So anyway, so we did that, and we haven't had a revisit for years and years and years. So it's a lot of fun to bring you back on here, Jay, for sure. So you want to just tell everybody, because we have obviously a different audience now than what we had 5 years ago, just
Sure.
Your background, how you got involved in Medicare and all this stuff and health insurance, the whole thing.
So I think that, the Substack and we have in common, Josh, right, which is to try to educate people correctly, objectively about facts, to try to get away from narratives. And the narratives can be because of a war story you heard from your friend at happy hour, or could be from a politician. It could be from the popular media. And I'm partially guilty. I think I told you that, today my new article is sitting in Kiplinger's, which just got posted this morning, literally, that it is very difficult to separate the signal from the noise, the facts that people have to have. And Maximize Your Medicare, the newsletter, my privilege of, appearing on your channel, are all really aimed to let's try to make sure that people have the correct understanding first.
Yep.
Control what we can control with the world that we have. Exactly. And not be pushed around by this other narrative, whatever the source. And there's so many different sources. I can't spend every moment of every day just saying that's wrong, that's wrong, that's wrong, that's right. Wrong. I literally would not be able to do any professional work. Literally, that's how much misinformation exists. And so when it comes to how I got involved here, so because of that, my first background is bond trading, bond derivative trading, and ultimately insurance of every form. A put or a call option. I know that you've had guests discussing it. So this was my original place in the far more complicated than Medicare. But what it did is it explains that people didn't understand what these financial contracts are. Insurance, people, and my number one message to people is health insurance is not the same thing as healthcare. My late father, physician, right? He practiced healthcare. He held a knife for a living, right? I'm trying to explain things about health insurance, which is a financial contract, ultimately. And from there, right, then we have all this jargon. But the reality is the jargon is there just because the carriers have to protect themselves. They can't, they're highly regulated, as am I. Over the years, I think what has changed, Josh, is that I have to be even more careful now when speaking in an interview or creating an article, because what ends up happening is, I'm the bad guy, I'm to blame, right?
Yeah.
This crazy person, Jay, he said this or that, and someone misheard, and now we got this game of telephone, and now, I'm the one to blame. So while I'm going to be speaking casually, and like you said, we've known each other a long time, I'm going to be speaking very, very carefully and being careful to not saying the extra thing. I'm going to say certain facts, but nothing more than that.
Yeah,
and from there, you've got a whole set of other financial, healthcare cost planning, vital. I can't express that enough. That you see a lot, and you've commented on your channel a number of times, right? Which is people are worried about retirement. Is it really a crisis, etc.? Well, for me, one of the most important reasons that people may feel worried is because they don't understand what kind of risk they are running when it comes to healthcare cost planning.
100%. Yep.
Right. So I know that you've got what 7,000 videos about Social Security, right? And the layer of income that it provides.
All
Right.
right.
Another way of stating it is, okay, let's also try to control expenses, because as you're considering retirement or retired, it is just as important. In fact, it can be more so, right? Because of the fact you're going to have expenses, but we're trying to control the unknown downside. And depending on who you are, you will have different sensitivity along that. Maybe you're Mr. Perfect, you're going to live to 150 years old. Well, the reality is that, but let's just say, for example, you have limited financial resources. You live on Social Security alone. Well, it is entirely rational to choose a particular Medicare option. It is entirely rational to choose a particular health insurance option, which would look entirely different than your 1-year-old brother who is Mr. Sick-a-Lot. Well, that person has an entirely different set of circumstances. They need to plan differently. They need to think through it differently. The only way they're able to do that is to understand how insurance actually works. And for that, I appreciate, my you having me here on your channel. So does that make sense? I think.
Yeah, I couldn't agree more. I think the retirement crisis is ignorance, because no one knows how long are they going to live, what could possibly happen, and that's where I think a guy like you can come in and say, look, let's establish the parameters that say if this were to happen, it's like a put option, man. I mean, how is your sensitivity to the downside? If we can minimize that to some degree, everything costs money, but that helps people say, oh, okay, I get that, because that's not what's happening now. In current retirement planning, Jay, is all like, oh my goodness, you could be, broke because of healthcare costs, and that scares the living bejesus out of people.
And it limits people from spending, right? For example, they have a nest egg, and it's reasonable, right? I mean, in the sense that people, let's just say the average case, and no one's average, right? But in Mr. Average's case, if they don't know anything about healthcare cost planning, how health insurance works, how they can control healthcare costs if they required lots of healthcare services,
right?
Then what do? Wallet. They don't go on vacation. They don't spend as freely as they wanted to under retirement because of the unknown. So to the degree, that's why, for example, and I'm sure you've got these services as well as we do, which is I don't start the financial planning process until you tell me about your health situation. Oh, yeah, and you tell me how much you know about this, because now I can frame, have an idea, context. Okay, we need X dollars for premium, but we need Y extra dollars because maybe you're going to have out-of-pocket costs. We need to know what the context is. It doesn't mean that you're going to sit on your wallet. It also doesn't mean you're going to live check to check. It's just that the solution is just different from person to person. And for that, I appreciate again your time, because I think that your message, as far as I could see it from the videos that I've seen and your messages over the years, has been very much of let's just get a hold of practical reality, the way the world really works, right? And get away from, because all of the behavioral biases that exist in the planet, they get attention.
Yep.
Right. It runs either extreme, and people look at that one soundbite and make overall conclusions from one single soundbite is just not sufficient for me.
Especially when we have, that's why we run the planning, though, to say, hey, look, it's, like I said, the parameters, man. It's like, can you handle this? All right, so you had just posted an article, which I just linked to on Kiplinger's, which is pretty interesting. Should you enroll in Medicare if you still have a job? So, yeah, so this is published by our friend Jay here. Kiplinger's. That's pretty cool, Jay. So you want to give us a little bit of the background of this article and what? Well, I want to go into a little bit more than that, but I thought this is pretty cool to jump into.
Sure. So what happens is the number one question we always get over a decade plus is, should I enroll in Medicare now, even if I'm working, or if I stop working after 65, have I missed a step? Should I have done something differently? And the reality is since the first edition of Maximize Your Medicare, the answer is now different. Meaning, what you can do is the same, but what you should do has now a lot of different options. If you are the full-time employee and you're covered by, you are the employee and you are covered by your employer-sponsored plan, you can delay applying for Medicare. Lots of people choose, okay, well, I'm going to enroll in Part A.
Yeah.
And that would be fine with an asterisk, meaning that there are exceptions here, which is you cannot, for example, no party can contribute to an HSA while you have Part A any part of Medicare turned on, period. Now, what ends up happening is since full retirement age is now 60, is approaching 67, like in minutes, then what ends up happening is someone asked me this question at 66. Should I now enroll in Part A because they didn't do it when they're 65? The issue is that they will backdate your Part A coverage date to 6 months prior, which throws up all sorts of problems, right? For example, and you can see why the nuances start everywhere, which is 6 months from prior to today, excuse me, let's call it fourth quarter of 2023, last year. Well, let's say you've contributed to your HSA during that time. You've now created a tax problem, right? Because you've contributed the max into your HSA.
Yeah.
You could only contribute, let's just say now your Part A date reads November 1. Right. You can only contribute 5/6, right? 10 divided by 12 times the maximum, since the HSA maximum is pro rata share, right, per month. So now you can see why I get asked by accountants to talk, and all these other parties, because now we've got a tax matter. And on it goes. There's a couple of other things here, which is that Medicare, and let's just call it adjacent, meaning Medicare Advantage, Medigap, that both will very likely, not 100%, but very likely have superior language for coverage than your employer-sponsored plan. So in Jay and Josh's landscaping company, we've got a small group. We have got this employer plan, $5,000 deductible, $1,500, $12,000 family out-of-pocket maximum.
Right.
And we're sick. Well, now, and you're 65.1 years old. You're $900 a month easily. I'm low at $900. That's at a competitive state. So now you can see what happens. In this article, I try to point out, without just the basics, too high a level, unfortunately, right there. I've got a 1,000-word budget to explain everything here. So
did we lose you? Oh, he's in Michigan, so we just lost him for a second there, Jay, because your esteemed governor shut off the internet. She shut off the internet. She said, "I don't want you to talk to somebody in Georgia." And we lost you at $900 a month
Yeah. So for example, let's say for example, we required macular degeneration shots.
Okay.
Thank you so much, Marie.
And we
So,
just ordered your
the
book.
thing is that in that instance, right, under Medigap or Medicare Advantage, you have a fixed known cost, which is not $3,000 for this shot that you need multiple times a year. So now if you add up numbers,
Yeah.
there can easily be these situations where, in fact, you should be on Medicare, even though you are fully working. And then we've got the whole other set of questions regarding, if you have a spouse who's not Medicare eligible, if you have a spouse who is Medicare eligible, now you've got a very complicated soup of different factors to consider.
And here we go. One question from Bill C. If my employer plan has or not, has not, I
Sure.
guess, drug, is that you? Can you see that, Jay, that question by there?
No, I see it. Yes. It's a fair question. So most of the time, and by most, I'm talking about 95% plus, if you are covered by health insurance from your employer, and that employer provides you coverage which is ACA compliant, it will have prescription drug benefits that meet the Medicare standard, and that is called creditable coverage. There will be fine print inside your group plan which says the prescription drug benefits in your small employer plan meets the standard that CMS has determined to be creditable coverage. And from there, if you have it, there's no penalty. I think that answers it.
Now, Andrew, this is why you need someone like Jay. I mean, this is not a sales pitch for Jay specifically, but how would you know? And Andrew's not a stupid guy, and Andrew actually had, I think he was against the wall not too long ago, Jay, in terms of fighting for his life. You know what I'm saying? So this isn't the difference between what Jay, let me just back up for a second. The difference between what Jay does and what I do, not trying to discount what I do, but when it comes to money, that's one thing. When it comes to the protection to the cost of your health, like Denise here, Jay, Denise, who said Jae Oh, she literally died last year, and has been brought back to life. I mean, literally, she was dead for 8 minutes. You know what I'm saying? So this is why it's one thing to kind of goof off on Social Security, and I say that with all, not Jay's doing it, but just a lot of people that say, all right, whatever. This is important, because here's Andrew. He was, he got cut up, sliced, and diced every which way to Sunday, and I'm just like, you gotta talk to somebody who knows what the hell they're doing. Jay, here's
So certainly we're available. First of all, right? It does not cost. We do not charge money for this, and like you said, Josh, today is not for soliciting new clients. We have plenty, but my point is that we will do this free of charge, as long as there's not these other complicating financial planning aspects that I just kind of even introduced, right? Because then you've got to think about a whole extra set of, entire investment strategy, not line picking securities. That is my original world, but you're talking about overall asset placement into accounts, et cetera, and you've got another 7,000 videos on that, Josh, et cetera. Right? So I mean, my point is that and then something I don't really say very often in my 3 minutes with Bob Powell on the street.com, I appear there 3 times a month, every single month. But the issue is that even once you have identified your path, let's just say it's Medigap or let's say it's Medicare Advantage, actually executing and crossing the finish line has more administration than you might think. And I urge people caution that what happens is you see price points which look like ties. In Medigap, for example, literally yesterday, I identified 7 brokers within $5 a month in a location. 7. That doesn't mean that I would just randomly choose one out of the 7. Like, Absolutely not. There are things that are in the paid version of the newsletter where I would say, this carrier's too new. So on a tie, why would you do this? This carrier, behaves in a particular way. Why would we do this? So these little nuances on top of just the general education and knowledge about financial contracts and health insurance. So, and like you said, so important.
Wait, and let me just
Vital,
say,
right?
Say again, Jay. Say again.
No, I tell. So I'm sitting on this Alliance for Lifetime Income. We've got these like hot shots from different walks of life, and there are a couple of us that are the same. Like if you're super ill, you're not looking at your portfolio performance compared to the S&P that day, like at all. I promise you, right? Or if your spouse is ill, that is we are not opening fidelity.com on that day. No way.
We're not placing a trade. That makes sense. Yeah, exactly.
We are worried about, okay, I need to pay for these medications. Yeah. How much is it going to cost? Am I in the sludge of an inland lake and I have no clue, or I have a good command of facts? And yes, I need to get these medications, but I also know that I'm covered in this particular way. I'm going to suggest, and I'll be very biased, and I will not apologize for it, to say, okay, maybe my book is overkill on having people have a little extra information to avoid that worry.
Yes.
To avoid that worry. That they know that they're not looking at their Social Security statement to make sure that, they got every dollar, that month as set on their annual statement. That's not what happens in real world.
Well, and along those lines about your book, here's my man in South Dakota. Just want to say thanks. Your book helped my elderly mom finally decide on a plan, and she's quite happy with it. So overkill is in the eyes of the beholder, of course, Jay. So people say, oh, man, this book's too complex. Yeah, it might be too complex for you, Misty, but over here for Homer's mom, it helped, it helped a lot. And like we said, though, if you're sick, you're not sitting there thinking, your portfolio doesn't come to mind. What comes to mind is, will I have coverage that will pay for the stuff I need to continue on? And then you're looking at this mountain of documents like, I don't know what the hell I have. And so you're going to call the provider. Again, I'm not trying to make this a sales pitch for Jay, everybody. I'm just trying to say, for the love of the good Lord, I'd say, let me call Jay's office and say, can you give me some guidance on this? Because Jay might have said, we've been through this before because I've been doing it for so many years. I mean, Jay is not a spring chicken, if you know what I'm saying.
Someone said in your chat, I do want to address this by Penelope.
Yes.
If you're a broker there,
she's my resident bot, Jay. She's just a bot, so whatever she's writing is just it's an inside joke. Initially, when Penelope came on, I thought she was a bot. So it turns out she's a real lady. So anyway, you go ahead.
No, this is a fair question, and I think this is a very good place to address it. Very good.
Absolutely.
Which is, it is true numerically, it is true that, for example, if a person comes to me and they want Medicare Advantage, that would we get paid more for that compared to Medigap? Factually, the answer is yes. Factually, the answer is when you first enroll, right? So when you are 65. If you are 66, the answer isn't necessarily true.
Interesting.
Okay, so that's first of all. So this is that situation that we started that when we had the introduction. We have these sound bites.
Yep.
We have these sound bites, and that's the only takeaway. In fact, there was an article by a health insurance think tank, and I think it's Commonwealth Fund. Yes, it was. That was, and New York Times came out relied on this article, which basically said that people like me will intentionally steer people to Advantage plans due to higher compensation. I can't speak for others, so let me first say that. Do I think that happens? Yeah, I do think that happens, right? If I thought of a 26-year-old newly minted insurance broker who requires rent. Yes. On a tie. That said, I can tell you that I found shocking because number one, our first goal is we want your patronage on our books forever.
Exactly.
Right. So that's first. And there's the idea of fiduciary, right? Which is kind of funny to me, which is that we don't have any choice but to describe. It's a kind of a question about fully explaining the implications and ramifications of choosing Medicare Advantage versus Medigap. We're now into the weeds of Medicare, right? Which is you're making a financial choice which involves a standardized contract Medigap, a non-standardized contract Medicare Advantage at a cheaper price. So now that's why we started when we talk about, puts and calls and options trading. Well, now you can use your common sense, right? I mean, if I change this to electrician contract, everybody immediately gets it. Immediately, right? It's like I signed a contract with my plumber or electrician, and the electrician or plumber can never change a single term or condition. Which one's going to cost more? It's obvious. Right. Obvious, right? And so does that happen? I'm sure it does. Is that the reason? No. And to some people, if they live check to check, candidly, they have to accept the financial risk as a practical reality. You will not hear from me, don't eat and pay for insurance. That simply is just not a combination.
Yeah.
But it is a very good, worthwhile topic to talk here, in your.
I just want to go back to what you're saying. So the electrician who you're signing a contract with, who can't change the terms later, that's the equivalent of Medigap.
Correct.
Okay. And then the electrician says, I'll change it whenever I want, on a yearly basis. That'd be the equivalent of Medicare Advantage. Gotcha.
That is right.
Gotcha.
Right. So which one would you be more willing to pay? That is household to households.
Right.
And now this is why I tell people when they think about their, personal circumstance.
Yeah.
Right. If you're Mr. Perfect, you have and you live on Social Security alone, and you're living check to check. Candidly speaking, we don't have $1,800 a month for Medigap plus Part D. Right. I make up like little stories about, I'm the old woman. I live in a shoe. I have 75 children.
Right.
And I live on Social Security alone, and I'm in perfect health. That person is completely rational to choose Medicare Advantage. Completely. Right. But as a contract, there's no getting away from the idea that one is in stone and one has moving parts. And those moving parts, you're starting to see some of the issues around it, and that's all the crossfire. More than 50% on Medicare Advantage at this point.
More than 50% of enrollees are on Medicare Advantage.
That is correct.
So let's talk about the email you sent to me earlier about what kind of change you see coming about all these things. They're coming. Sure. And again, this we don't know. It's all speculation, but what's your vision there, Jay?
Sure. I think that you see on Medicare Advantage, I think you're seeing pressure. I think those pressures will continue. That means, by implication, that could I see the extra freebies, the extra benefits being challenged or curtailed? I think that is very possible. For example, in many locations, there's the idea of give back, which is money getting actually added of the $174 for Medicare Part B, that some of that is being rebated via Social Security. Health club membership, OTC card, dental and vision, etc. These extra things that are not part of original Medicare, but are being added on to Medicare Advantage in order to attract members and keep their membership, right? It's something like 95% do not change.
Wow.
Yeah, they do not change their Medicare Advantage plan, even though they should. But anyway, that's a different topic. But my point is that what you have is, it's like me. I saw a picture on Facebook. You've got these children, right? Who used to be children. They're taller than you now, it appears. But anyway, my point is that let's say you gave them an allowance, but not, and before you gave them extra money if they got good grades.
Right.
Well, now all of a sudden, let's say, okay, B plus doesn't cut it anymore. I'm not going to give you extra allowance for B pluses. You need A minus. And now they go, we got a problem. I've got to watch TV. I've got to go play sports. I've got to do this other stuff. I can't get to A minus. And now all of a sudden your allowance goes down. Well, now they don't have the extra money to go and buy,
right,
apps for their phone or whatever it would be. Well, in the same way, that's how the money gets distributed from the government to Medicare Advantage carriers. The carriers are like your children who are then distributing their allowance into the packages of benefits to attract members. Well, if I make the standard more difficult to get this money, what's going to happen?
Yeah.
And this is what I'm talking about by the understanding and the overkill. My channel about Maximize Your Medicare and the comments that I make is that everyone knows that the price is lower, and I didn't say don't eat and pay extra, right? By that same token, if that's the only thing that that is attracting you, you need to think carefully. I've already stated annual contract. That means every detail subject to change. And one of those can be, what happens if your allowance is lower?
Yeah, absolutely.
For whatever reason. Right. And so very difficult. And from there, Jay just takes orders, to be candid with you. I would agree with Kirk. That's correct. Right. Which is that. But that's why I try to make it basic, meaning that to say, look, insurance, you're buying a protective layer. It's a question of, does this fit in your finances and your health situation as you know it? And the best thing about health insurance for the consumer is you have the information advantage. You do. Meaning that if you're a female, if breast cancer runs in your family. Right. If you're a male, hey, I spent way too much time during college at the bar and not nearly enough time, at the library. And I've continued on through my 30s and 40s. You see what I'm saying? In other words, certain things about your health and lifestyle and your genetics that the carriers, they do not have any right to deny your application or change the price if you understand the rules.
So the standard in this case would be the insurance companies from the government, the parent. The parent said, hey, you get a B plus, you get an allowance. The insurance company says, great. And then they went buy all these apps and all this crap. Now the standard is saying, no, we need an A minus. The government is saying to the insurance companies, we need an A minus now. And the insurance company said, well, that means we don't have as much money to give to, dentures and all the other stuff that we're providing.
That is correct.
Interesting. So Medicare Advantage inherently is going to be, we don't know, but it's kind of some of the bells and whistles will be minimized because
can be.
Right.
The flip side of that is that, the carriers are plenty smart, right?
Yeah.
They've got unlimited computing power and they're working to make these pieces fit.
Right.
And they're working hard. Right. In other words, that they are competing hard one with the other. So what has happened over the past years, the allowance was high.
Yes.
And they know that 10,000 people a day and now 11,000 people a day turning 65. So what do? they are finding every mechanism to try to create this combination of benefits to have more membership, which, candidly speaking, is complete common sense, right? I mean, I know it's easy to identify carrier number one and saying they're the root of all evil.
Right.
But the reality, if I change the topic to any commercial topic, the answer is, oh, that's what I would have done. That's what Jay and Josh's insurance company would have done. Of course it is.
And if over a majority are now on Medicare Advantage, and the vast majority of those people don't ever switch, which they, like you said, they should at least think about it. That tells me that I'm not saying these people are happy, but they're content enough not to revisit what they have, or frankly, they might just be lazy and be perfect. Or like my man, like you said, Jay Kirk says, they just say, I don't know what to do. I'll just wait until something happens. But that's
and I would just very strongly. This is why I like to spend time with you and people in public. Which is, if I could tell persons, is that if that complacency in this situation doesn't, can only hurt you.
Yeah, what I'm saying.
It can only be negative, right? Meaning that I have no problem that you flipped over rocks. You've asked me questions. You flipped over rocks. The conclusion is no change. That is 100% acceptable. The idea, however, is I'm just going to leave it alone because I don't want to flip over the rocks, because underneath the rock is a scorpion.
Yeah.
That you could have identified. And to know, and that's what I'm saying about you knowing what your health situation is.
Yeah.
Right.
Gives you the upper hand.
You have the upper hand.
Absolutely.
Consumers absolutely have the upper hand. And now, you can ask me questions about the Affordable Care Act, right? Because we have, silly season coming, and, that healthcare, of course, and healthcare costs being, it's probably not going to be the headline of, election politics, but it doesn't matter what party, this is a very high priority item. Always.
That's what I'm saying. It's interesting. My man Gordon here says some may be afraid of the underwriting process in order to change. What's your thoughts on that, Jay? You seen that in your own experience?
Yeah, I do see it. You do want to be careful, right? Which is that it's nothing to fear, right? Because first of all, let's just say you are already a Medigap owner.
Right.
Your rates are increasing to a degree that become too expensive. You have the right to change, but you have to pass Medicare underwriting or medical underwriting. There are exceptions based on the state. There's something called the birthday rule or anniversary rule. But in most states, you have to pass these medical questions, but that doesn't mean that you can be ejected from your incumbent carrier, right? Mm-hmm. So that shouldn't be a source of fear.
Gotcha. All right.
The same thing for Medicare Advantage, meaning let's say you're on Medicare Advantage from carrier number one, and you want it, and you've now thought through, and you were Mr. Perfect, and now you're 70. No medications, etc. It's not a problem, right? Meaning, I can tell people that step number one is to look at medication list, right, by carriers, and if it shows up as blank, I promise you they want to accept you. If it's somewhere along close to the line, let's just say you've had some history of certain, let's just call it you had stomach problem, Crohn, GI problems. In that instance, it's going to be more sensitive, and you'll want to be careful, because if you get rejected by a Medigap carrier, that information is shared across carriers, because, and good reason, right? Which is to prevent insurance fraud by consumers.
Exactly. What was that?
Right. So this is one of those things, right? Insurance carriers are the root of all evil. Yeah, but the flip side is they have to protect themselves against something like that, because otherwise, if I could run around and cherry pick and I'm the advocate for the client, that's what I would do. You see what I'm saying? So,
that'd be your fiduciary responsibility on behalf of the client. You know what I'm saying?
Correct. That said, do I direct clients privately that with no assurance of guarantee? Because I can see what the implied questions are. They are sharing to some degree. Here's the line in the sand for our carrier, and the different carriers will decide differently if you require medical underwriting. Very subtle.
But it sounds like if you have no prescriptions, it's pretty much open game. You can pretty much go anywhere, it sounds like.
Yeah, I mean, I think that if you have no prescriptions, and for example, I mean, and I've used the 20,000 foot view, right? I mean, of course,
yeah.
Right. But that's a very easy way for those persons, and you are not, even if you are overweight, or what you consider to be overweight, different carriers will have different standards there as well.
Yeah, okay, interesting. But either way, it's like this guy says, travel nut. I think you should evaluate yearly any Medicare Advantage plan based on your own claims experience. I mean, why not? Other than like Penelope saying, she just you're changing is scary. It is scary. They're changing anytime you're changing. I mean, hell, Jay, just transferring from Fidelity to Vanguard or something like that. I got a guy in California. He's moving $800,000 from his 401k to Fidelity. Like, emailed me because I'm scared they're going to lose it en route. I said, dude, I get it. It's a lot of money. It's not going to happen, but anytime you're making a change, it's nerve wracking for sure. You know what I'm saying?
I think that that's human nature on anything, right?
Okay.
First of all, I would remind people when it comes to insurance matters that while you may I can understand the discomfort.
Yeah.
The chance that I would violate it is zero. The chance that the carriers would violate it is also basically zero.
Yeah, we're saying.
Because we are so highly regulated that literally now what is new since the last time that we spoke, Josh, is when someone calls me about Medicare, most of my communications are on email so that we avoid misunderstanding.
Yes.
Okay? And for the people who absolutely require phone call, I have to keep it a recording for 10 years.
Whoa.
10. So you can see what I'm saying. You can see what I mean is that I can understand the skepticism that our society has. That makes sense. Some of that is earned. But then if you put on your common sense hat, really, I'm going to threaten my book, my practice, my affiliation with Think Tank and it's even worse on Part D, we've got actually the opposite problem, which is certain Part D plans are not going to compensate me at all. So I'm going to accept the full regulatory risk.
Exactly.
And I have to keep the phone call for 10 years and also get zero.
But you're just altruistic, Jay. You're just an altruistic man. You know what I'm saying?
Oh, don't get me wrong. I'm happy to share this information with people. That's not the problem. The issue is that some person in, the middle of Timbuktu throws a rotten tomato and says, I heard this crazy Jay guy say something and they misunderstood and, it's his fault. And they file a complaint. I basically have to stop my work entirely and deploy every financial and legal resource that I can get in order to prove it my point, which is
that's all the issue. So everyone wants to blame somebody else. You know what I'm saying? Going back to the insurance companies, everyone wants to say the insurance companies. Everyone wants to say the insurance companies are the bad guys. Like, how much insurance fraud is committed by your next door neighbor? I used to work at USAA, and there'd be people like, I lost my wedding ring. And you're like, and these are like veterans from, freaking, And just, it's like there's always scumbags, man. And the reason there's a regulation is because the insurance companies were scumbags, but also the consumer were scumbags too. And you got to, it's just yeah. So Andrew says right here, I know an ACA broker recorded all of our conversation. It's SYI, man. It's CYA. It's what it is. What all right, so if Medicare Advantage is getting squeezed, I don't want to take up too much more time, but what's your thoughts on just general Medicare and Medicare subs or Medigap going forward? Is that going to be cheap? I think the premium for Part B went down, and now what is it, Jay? Is it gone way back up? What's your thoughts on Part B?
It's just under 175. I think what we are seeing in Medigap, I do want to just make the couple of points, which is in certain locations, just still brutally competitive. Plan G, 65 years old, $100 a month for a female is possible. Okay. That said, what you're having is that, for example, you've got other clauses, Inflation Reduction Act, changes to negotiation of prescription. If that costs Medicare more and Medigap covers the difference, that means the Medigap carrier has to pay more, meaning that premiums higher.
Yes.
Right. In a competitive world, right? In other words, Jay and Josh's insurance company, we don't run a monopoly, right? We will have very highly qualified, competent competition. And we are seeing that, which is that while competitive, that what you have is more expensive over time, more than people have thought, oh, well, I'm going to pay $100 a month. Great, I can afford $100 a month. Well, what do you say when it's $170 a month times 2? Right. So, you just want to keep on top of it and know that this is coming. And I don't think that is going to, but that also fits under the umbrella of things that you cannot really control. Exactly. All I would say is the carriers aren't randomly increasing the rates.
Right.
That's not right. You worked for USAA, right? I mean, that there's nothing random about the increase in rates, and especially in health insurance,
right?
Because they've got to prove that they're using 80%, and let's forget the accounting machinations, which I'm certain exist, but 80%, they've got to show the regulator in order to get approved, right? So just because your next door neighbor is also with your carrier on Medigap and all of a sudden gets 7 types of cancer, that's the thing that you could not control.
Right.
So I try to encourage people just to control everything that they can and to ask until they're satisfied that they do have the important facts, under their hat, so they can make the common sense decision for themselves.
And one of the things they can control is getting in better shape. I mean, that's the issue, is that if you want to, fight with the insurance companies being heavy, overweight, all these prescriptions, well, maybe one of the things that people can do is say, I'm going to cut back on this, that, and the other, and give me a better chance of being underwritten for maybe a better product at some point. It's no different than life insurance. Like I think I got approved as standard when I had high triglycerides, Jay, as about 20 pounds overweight, and I said, yeah, we'll give it to you, but it's going to cost you a freaking arm and leg. I said, let me come back to you, and I lost some weight, and I went low carbs, and next thing I know, I said, okay, now we're approving you as preferred, and it's I'm not saying the same thing will happen in health insurance, but none of these things are random. None of these insurance products they're not just saying, we're going to raise Scalen's premium by $100 a month. It's all actuarial based, all of it. And then with the health insurance, it's so heavily regulated too, and profit margin limits and all that stuff. It's just I don't like the insurance companies any more than the next guy. I just think at the end of the day, it's an easy whipping boy that might not be as bad as what it can seem. That's for sure. But
and I'd say the same thing about the politics here, Josh. And I know we don't have that much more time, which is that very frequently, for example, we've talked about insurance, et cetera, and then somebody's going to intervene and say it's not supposed to work that way, and then some other. I tell people, that's a philosophical debate.
Right.
That's a philosophical debate. I'm not here, Socrates, 301, right, was is the place for that debate, right? The carriers, I promise you, there is no line in any application asking you what your political affiliation is, or what your religion is, or what your philosophical views are on the role of government in American life. There aren't, those questions do not exist on any application, right? You and I think this is why, I appreciate you, right? We are here, and I'm here like more stubbornly than most, which is to say, I'm trying to explain the world as it is,
Yes.
not
Right.
to adjudicate fair.
Right.
Right. I'm not going to be able to adjudicate fair. I'm not going to be able to sway persons on what, the definition of fair should be.
The kind of like Social Security. People like Social Security was never supposed to be like that. I said, okay, but it is like this now. So we can argue all day long about what it's supposed to be. What does that do? All right. So my man here, how does someone get to do what you do? I'm sure some early retirees might be interested in helping others in this field. Look at Kirk. This is Kirk is Korean. We didn't know that before. Kirk Royce is Korean. That's Jay's long lost brother from Portland, Oregon.
So I was saying mother. I didn't know my mom changed her name to Kirk. my brother doesn't want it, that I do not have. He probably would not like me. Anyway, you can, if you sign up to the Substack, I tell people the best way to get an idea is the newsletter. There's a free newsletter. It talks about different topics. Like I said, I'm part of this think tank, Alliance for Lifetime Income. It's an education for advisors and consumers. For example, it talks about the role of how an annuity is a layer of income. It's not for everybody. It has a place for some. But again, it's not trying to keep away from the bias that you see in advertisements, etc., and still be correct, right? I mean, in other words, I'm also not the person to say, okay, every person should have an annuity because it doesn't fit every person. By that same token, to say, okay, never never is rarely. The only time I would ever use the word never is I say never give away free options. That's the only time that I use.
You've been saying that since I've known you. Never give away.
Never give away free options. That's absolutely right.
Last question. Would you think it's my man Bert Weeks, who's not very weak? He says, would it be fair to say G would increase rates faster than N? Oh, good question.
No.
What do you think? No.
I'm going to be in the minority. I may be in the minority. I've seen this rationale.
Yeah.
First of all, it has not worked out. This rationale has been there from the beginning. The year that Plan F stopped, this is the rationale I've heard. Okay.
Yep.
What I would tell people is the following: is they can choose the carrier that these differences, the carriers are intentionally setting this difference. Again, like you said, Josh, right? This is done by actuaries, not by randomness. Right? They are determining it.
Yep.
But the reality is, for example, and now we have data. We have data from California that unnamed carrier X, which may be amongst the largest carriers in the nation, Plan G, Plan N increase exactly percentage-wise the same. And so I'm not in that camp. I will share with you the one thing behind the paywall, which I'll share with you, which is I am not in Plan N camp at all. And the reason is I don't want to leave the excess charge option to anyone else. You're the buyer of an option. The function of the option is to shut down volatility, right? You're buying back the option that you're short. You're short an option to Father Time. You're short an option to moving rules and payments from governments, to doctors who are taking a pay cut. This year, a doctor is taking a 5% pay cut, 4% odd. Josh, if your doctor, if one of your children wants to be medical doctor, right? They're looking at minus 300 grand.
Yes.
In educational debt. Easily.
Easy.
They want to be a primary care physician in the middle of Timbuktu in a city of 20,000. Guess what?
Yeah.
You're to tell that child, you're to get that excess charge. The end. You need every dollar. You're minus 300,000.
Right.
That is the completely rational thing. Now, the reason I'm being this enthusiastic, now I'm animated, right? Which is that you're the buyer of option to not be open to that outcome. Now it's up to the buyer. Is it worth the price difference between G and N?
Yeah, absolutely.
And you see what I'm saying? So that's why we started this with options talk, right? Which is, okay, right. Now one's better. Now let's assign a price. Now we've got a person. Is it worth it to that person?
And just going back to the idea too, that it's just all, I mean, I just think we just will close here, but at the end of the day, the insurance company is, we already talked about it. It's options for the consumer, what they can get for their money. And then the
Correct.
Insurance company's trying to do the same thing within this band of the regulation that comes with it. So everyone's trying to
get tight
band. Competitive
recorded phone call for 10 years. Tight bands.
Very tight. And very regulated. All right. So Jay, good stuff. So again, maximizeyourmedicare.com. I'll put all links when we're done here in the comments, but the Jay Substack, I put a link on the beginning. I'll put again. So if you watch
Jae.substack.com, that to me is the place, because then you'll get the access to, maximize your Medicare, et cetera. And, I'll have people's updates on different topics, et cetera.
And they can contact you through there too, Jay. They can find your contact.
Absolutely. All of that is 100%, so that's kind of like a very good central spot.
Good stuff, man. Appreciate it, Jay. I'll send. I gotta go take care of my dogs. They're upstairs.
Well, you've ignored me for like 10 years now, because you've been on to bigger and better. So hopefully it won't be 10 years until you call me up.
Well, I got so big, Jay. I just got to leave the peons behind. You know what I'm saying? Because I'm
that's okay. I'll get over it. It'll be fine.
If you're back in Swanee, if you ever come back to Swanee, where your homeboys are, you know what I'm saying, down here in North Georgia, you got to let me know, man, for sure.
What I do want to come to Atlanta, in Duluth is lots of good Korean restaurants.
Yes, 100%, man. Yeah. Duluth, that whole Gwinnett County, man. That's your stomping grounds over there, Jay.
There's a lot there. All right, Josh. I appreciate you. Thanks very much. Thanks for your audience.
You got it, brother. See you.
Bye.